Hello and welcome to the Good Gut Feeling podcast, where we digest modern medicine with old world wisdom. This is Dr. Alexandra Shestina. I am your host for this weekly podcast, and today we have a real treat. We have a guest today who I've known for a number of years. Dr. Hoffman was one of the pioneers. He started the Intelligent Medicine radio show that's been running for many years and now a podcast. Intelligent Medicine is the longest run doctor-led radio show in the United States. And most of all, he's very passionate about creating real health. He practices what he preaches. He is an athlete. He's run the marathon. He's done multiple triathlons. And he himself eats his healthy salad and salmon diet, as he calls it. And I am so excited to have him on the show today. Welcome, Dr. Hoffman. Thank you so much for coming on the show. I am so excited to speak to you about today's topic, about how you got into this field, this world, and you've inspired so many physicians to change their practice and so many people to live a healthier life. So welcome, Dr. Hoffman. Good morning. How are you today? I'm so excited to have Dr. Ron Hoffman here today. I've known Dr. Ron Hoffman for years now, and he is one of the most established premier doctors who have transitioned from regular medicine to integrative medicine. And I know that process was very challenging for me in 2016 when I decided to make a shift, and Dr. Hoffman did it a long time ago. And I'd love to hear about your experience, about why you shifted, what made you change, and how that process was for you at a time when not so many doctors were doing this.
Well, thank you, Alexandra. It's a pleasure being here with you, and congratulations to you for embarking on this path successfully as an integrative gastroenterologist, which is a rare breed. So my background is that I was kind of a science nerd in high school. I would ask my mom to go to the butcher and bring back hearts and eyeballs and things like that. And I really kind of got into it. And then I went to college in the 1960s and 1970s, and I was at Columbia. And if you think about, what Columbia is like today, it's kind of the same thing, except the issue was Vietnam. So it was kind of square to think about, going into a conventional field like medicine or law. And I took a lot of humanities courses, studied anthropology, which helped me eventually because it established kind of a sense of cultural relativism. In other words, the practices of so-called primitive peoples actually work for them in terms of maintaining their health. And then I got a job working for the city of New York, and I lived in Greenwich Village at a time where they had health food stores, and we were talking about macrobiotics and vegetarianism, and I attended lectures on acupuncture and homeopathy and herbal medicine. And I thought, maybe I'll become an herbal medicine person, or maybe I'll become an acupuncturist. And then I thought, I've got good credentials because I graduated Columbia, but I haven't taken the science courses. I had to go back and I had to take all the sciences. And then I applied to medical school as an older student, got in. But I was kind of a stealth medical student. I never fully enunciated the view that at the end of the process, I was going to go full bore into what was then termed holistic medicine. Now we call it functional medicine or integrative medicine. And at the end of my training, my residency, they said, okay, what specialty do you want to go into? And I said, I would like to go into holistic medicine. And they said, oh my goodness, you're going to throw away a great career? I mean, you have such a future in medicine and you're going to do that? And I said, yeah, that's really where my heart lies. And at the time, there were role models. I was kind of a pioneer. There was Dr. Atkins. There were few and far between. You could count them on one hand, the number of holistic doctors in New York. And we began practicing. And in those days, there was always the threat that we were going to be taken out by the medical authorities, that just per se, the practice of holistic medicine, doing it differently, was going to get us into trouble. So we formed a kind of a protective organization under the auspices of Dr. Atkins. We actually changed the legislation in Albany, New York State, so that it was legal to practice holistic medicine. It wasn't per se a violation of, medical rules to suggest, for example, that instead of taking a medication, that people undertake a program of diet and exercise and maybe use supplements or botanicals to treat their problems. And the rest is history. I maintained a practice for 40 plus years. And, and I think you had a similar experience, although there's been some progress, but at the time there was very little in terms of resources to learn about the kind of stuff that I wanted to learn about. So I had to kind of shape my own education around nutrition. I had to go to other programs, add nutrition. I went to acupuncture school and traditional Chinese medicine school. I went to places where they were doing nutrition research to kind of round out my education. Plus, I went to tons of conferences and I listened to what were then cassette tapes or riding in my car to medical school. Remember those? I don't even know if you know what cassette tape is.
Yes, I do. I do.
Yeah, okay.
Like sometimes like the ribbon would come out and
exactly.
you'd have to wheel
take
it
a pencil and kind of straighten it out. Yeah.
Of course.
So, right. So that in a sense, I was self-taught a little bit around nutrition. And fortunately, the situation has improved. But I got to say, I'm very heartened by an initiative by RFK Jr. as head of HHS to actually tell medical schools to teach nutrition or lose federal funding. How about that? Because so little progress has been made. It's a sad fact that in the U.S., 86% of physicians report that they feel unqualified to offer nutritional advice to patients. And that's really a shame. And especially in your field, which is gastroenterology, you would think that it's so intuitive that nutrition is important. If you got a problem with your plumbing and, you call the plumber, first question the plumber's going to ask is, hey, lady, what'd you throw down the toilet? But if you go to...
That's a logic that's not taught.
you go to a gastroenterologist and you have some horrible stomach ailment, they're not often going to ask you about what you ate, what you've been eating.
So it's interesting because I say that to people, like unfortunately, I don't know if this was your experience in your practice, that many patients who come to me, I'm like their last resort. They've tried they've been to 5 different specialists. They've traveled who knows where. And now they're just desperate and have lost hope. And then I talk to them about a number of things. A big one is nutrition. And they're shocked. They ask me, well, how come the other doctors didn't discuss that? And for me, that's normal because when I was training in the first couple of years that I worked in the hospital, I didn't either because it's just not part of the training. And not only is it not part of the training, I mean, as a gastroenterologist, which is, digestive medicine, all we really learned in terms of nutrition is how to administer IV nutrition and ICU. Yes. We learned some tube feeds, some basic tube feeds, which most are extremely processed, the commercial ones. I don't know if you're how experienced you are with that, but
yes, synthetic food, it's made out of corn oil and
and it's like for a gastric tube, all you could just put in soup. It doesn't have to be any specific formulation. It just has to be a certain kind of consistency and the right nutrition. So that I learned. And then I learned, obviously celiac patients don't eat gluten, and that's really it. And so that's all I knew. And then now that the way I'm practicing, not only am I hearing that doctors are not giving any kind of a nutritional advice, but there's a number of gastroenterologists, probably the majority, who are telling patients you can eat whatever you want. And
right.
They're telling
as long as you take these medications, they're going to make you bulletproof. And when you see some of these ads for drugs for ulcerative colitis and Crohn's disease, they're often people are at a country fair or something, and they're looking longingly at the chili dogs or the pizza, and it's kind of nod their head no, not today. But then after they take the medication, it's they can eat whatever they want with impunity.
Right. Exactly. It's it's hilarious. But they're not only they're told that diet makes no difference at all. Like their disease was not worsened by the diet. The flare was not in any way initiated by the diet, that the diet is really completely irrelevant.
Yeah.
And there are some progressive doctors that are, doing some talking a little bit about the specific carbohydrate diet or the low FODMAP diet.
Yeah, that's become popular.
That's become more popular. Yeah. But it's
there's so much more to it.
So much more to it, because you can eat SCD friendly foods and they can be processed junk.
Mm-hmm.
And as long as it's, fits under certain criteria.
And just speaking of the SCD, let me just, double click on that. That to me was a revelation, because when I first began treating ulcerative colitis and Crohn's disease patients, I learned from Elaine Gottschall, who wrote the book Breaking the Vicious Cycle, about something called the SCD, the Specific Carbohydrate Diet. And that's morphed into, carnivore diet. Now it's more popularized as carnivore, avoiding certain plant foods. But in those days, SCD was really a mainstay. And I just saw remarkable turnarounds without invoking medication in people with the most, people would walk in emaciated and, with 15 or 20 bowel movements per day. And we could turn that around. It took time, and it took a lot of dedication on the part of the patients. It's a special kind of patient to adhere to that. But if, they're given these tools, they can really make progress.
Right. It's so logical. It's so logical that your digestive system is going to be affected by what you put into it. But I say that only doesn't make sense to doctors. If you put some random liquid into your car instead of gasoline, you wouldn't expect it to run, right? But if for some reason it makes sense to us that we can put all sorts of chemicals and toxins into our body in the form of, dinner or lunch or, food, and we're going to function the same. So it's definitely really, it's completely illogical. But it's been accepted as the norm. It's been accepted as the standard of care to do that. No one ever questions that. Why a doctor did not prescribe nutritional advice. That's not even considered as a standard issue, whereas a medication is considered standard. And that's, I think, the shift that needs to occur in medical school, because the standard is pharmaceuticals. That's the foundation. And probably this is your medical education, and my medical education was for every system we had like a packet like this thick of pharmaceuticals. And it was the hardest part of the class to memorize all those and memorize how they're used and their adverse effects. But so there was nothing.
A lot of medical school, in my opinion, was understanding physiology in order to decide which medication to use. And it was really geared to that. And a lot of your medical school is underwritten by the pharmaceutical industry. A lot of professors are receiving pharmaceutical grants. Even some of the textbooks, some of the wonderful pictures and slides come to us from pharmaceutical firms. So the pharmaceutical firms have very thoroughly infiltrated medical school curriculum. And hence, and there's not a lot of room in medical school curriculum to spend time teaching kids nutrition. So, the goal is you got to pass these certain tests, qualifying exams at the end of medical school to verify that, learn the stuff. But it's all geared to a conventional medicine approach. And less than 1% of the questions on those exams that you take are geared to a nutritional intervention. So hence, medical schools are not incentivized to teach nutrition.
Definitely not.
So that's got to change.
And how do you see that changing?
I see that, we're getting some pressure from above, because literally RFK Jr. is saying, hey, we're going to pull your federal funding if you don't make some changes. And in fact, I'm talking to my medical school about including more nutrition training for doctors in their programs. I, want to be a change agent for my medical school and give back to them because, I value the training that I got from them, but I also want them to fill in the gaps when it comes to doctors, understanding where nutrition fits in. They don't all have to be like you or me because we administer nutritional care, but at least they should see where the opportunities are to make a referral to a registered dietitian or a certified nutrition specialist, nutrition professional, and have those people embedded in their care team. So that they don't need to know necessarily all this, but they should at least see where the opportunities lie and the potential of nutrition to turn things around.
I think also because the system has been geared for so long is going to take like maybe a shift from the individual doctor who's been practicing for 30 years differently. And maybe I think that's also a little bit of a challenge for people, because to learn that everything that I learned was maybe not exactly the truth. And I think it takes some humility to say, like, I don't have the answer, but maybe this person can, even though I am this, the specialist and fully trained.
I think we were trained, to the motive to go into medicine is most doctors, and they write this in their essays, they say, I'm really into science and I want to help people. Okay, so like it's applied science. So the problem, though, is that we're taught not science is inquiry, and it's continually changing, and we're looking at controversies, and we're upgrading our understanding, and we're using our judgment or discretion to decide, what's best for the patient. A lot of doctors merely are trained to follow guidelines and algorithms, and in a kind of robotic way, which is good. I mean, if everybody made it up as they go along, that wouldn't be good. But to standardize care to the point where you can't think out of the box a little bit, I think really eliminates the creativity and the potential for real advancements in medicine.
Absolutely. Yes, the guidelines are extensive. And, when you start looking at the actual guidelines and the quality of the evidence it's based on, it's not always good. But people follow them because if you follow the guidelines, you're safe, you're good, but it's not always the case. And the guidelines change also. And that's another, I think another thing to consider. Like, these guidelines are not the 10 Commandments. They change and they shift all the time. So it's, we can be ahead of the curve and think and not be robotic, like you said, or we can just, kind of go with the status quo. And the stats are not with us in terms of how the United States is doing as a healthcare corporation.
And medical economics kind of stacks the deck against us because, if you probably spend a lot of time talking to patients about nutrition, that it's really not well reimbursed. What's better is if you would just talk to, 25 or 30 patients a day, just line them up for procedures, endoscopies, colonoscopies, and you could just churn them out. There's a lot more income potential than sitting and talking to patients and educating them and motivating them. The reimbursements are really in line with a procedure-oriented type of medicine, as opposed to the word doctor means teacher originally.
Right. It's absolutely true. And I know the trend with most gastroenterologists, if not all at this point, who are within the insurance model and practice, conventional standard medicine is to get as many endoscopies scheduled as possible. The point of a visit is to schedule an endoscopy. And once that's done, it's like, okay, see you in 5 years when you're due again.
Which it also incentivizes you to do perhaps, a lot of CYA medicine. In other words, if somebody has a little stomach pain, instead of trying a natural approach first, it's like, oh my God, it could be gastric cancer. Like, I'm going to get sued. Plus, I have the incentive to perform an endoscopy, and then I'll put the person on the proton pump inhibitor for life, which is, as you know, one of the biggest disasters in medicine. The tens of millions of Americans who are consigned to a lifetime of side effects due to dependency on these medications, which are hard to get off of.
Right, exactly. I remember when maybe I don't know if you had this experience, but when I was an internal medicine resident, like, it would be part of the standard admitting orders to put someone on a GI protective PPI, and really wasn't even indicated for that. It was really indicated for critically ill.
Yeah, the idea was you're hospitalized, and so you're under a lot of stress, so we better put you on an antacid. Yeah,
right. and the problem was that the resident who's discharging the patient is either a different resident altogether, or some, and for sure someone who's like rushed and busy and overworked. So they're not like going through every medication and thinking like, do you really need this?
Yeah. So they see that you're on that medication, and then they send you home on that medication, and you're on that medication for life. Well, and then they wonder, why is there so much C. difficile in the hospitals? Why is there an epidemic of this very devastating condition, which is due to microbiome disruption that comes from taking these strong acid blockers along with many antibiotics that patients routinely are administered in the hospital.
Right. I mean, it's a killer combo. And then the exposure to the resistant C. diff it's a package deal when you walk in. It's an unfortunate system, but I don't know if the training has changed at all. But I think part of the training was just that it was just so you're so busy, you didn't have time to think.
Yeah,
and
it's kind of like drinking from a fire hose, literally. And a lot of medical students, as you know, enter very idealistically. By the time they're finished, they're so beaten down, they just want to get it done with. And they hope to get into some kind of lucrative career so that they can pay off their enormous student loans. And then their hands are tied. They just have to kind of go for the bucks.
Right. The bucks and the lifestyle.
Yeah.
So hence dermatology, radiology, those are, people go into like the fields where they can, have a normal life and make the most money without having to deal with too many headaches these
That's
days.
kind of a new concept in medicine, by the way, this concept of lifestyle, because, it's no accident that they call interns, because we were literally interned in the hospital. It's like round the clock. And so lifestyle, that's a relatively new concept in medicine, but it's good in a way, because doctors are finally obtaining more balanced lifestyles. Doctors are probably the least likely to experience the benefits of a balanced lifestyle with proper exercise, sleep, and the opportunity to choose and prepare foods that are healthy. Hence, there's a lot of burnout. There's a lot of sick doctors. A lot of have you had the experience of people coming to you saying, "I'm here because my doctor passed away." Oh, I'm sorry. How old was your doctor? Oh, 55. No.
Oh, wow. No, I haven't heard that so much, but I'm sure, because if you look, I look at the people who I practiced with and trained with, the senior doctors who trained me, they were all overweight and they were all stressed. And I remember how we ordered food, it was for journal club or for whatever grand rounds. It was like not healthy stuff.
Off the patient's tray, just to get you through, the next few hours, because there's little time to eat. But right. Drug companies would often sponsor journal club, and then they would bring in the hero sandwiches or the pizza, because they knew that was the way to residents' hearts, right? Is to feed them.
Right. It was and donuts.
Oh yeah.
And donuts bagels and cream cheese were very popular for grand rounds mornings.
Yeah.
There was no.
The only way to bring us in on weekends for weekend rounds was for the attending to buy us coffee, bagels, and cream cheese. That
God, we were bought so cheap, right?
Yeah. They would buy us off that way.
Yeah, the culture is definitely not aligned with health, and I remember, because I was into it when I was doing my GI fellowship. They used to ask me, like, do you want to live forever? Like, they thought it was so weird that I would like even question the food when we went out to dinners, and I would like ask, I would be selective in the menu, and they would, and I would get like a lot of crap from the team, like, oh, you want to live forever, like you're high maintenance. It was like, not only was it not like done by the others, it was also kind of like frowned upon. Like, it's not, It wasn't cool.
I got some derision while I was a medical student and in residency, when I would, open up my lunchbox and I would have like, tofu and seaweed. And at that point I was a vegetarian, and it was like, oh my goodness. And then at one point they said, you better get a hep screen. And they said, how come? You look kind of yellow. And I said, yeah, because I'm eating tons of fruits and vegetables. And I'm a little carotenemic. I've got that little bit, that yellow tinge from all the beneficial carotenoids. And no, I didn't get a needle stick. And that's not, look at my eyeballs. My eyeballs are okay. My skin is a little bit.
So how do you see this, in terms of like my question always with this process of kind of like starting to introduce nutrition education is even the way nutrition is taught, in the standard RD programs, it's not great.
Yeah.
It's really like, calories, like, the ADA diet, the
More
American
in,
diabetic.
calories out. Yeah. Right.
Yeah. And like basic things, like 2 grams sugar for the cardiac patients. I remember that I would write that on the orders for my inpatients. And I think that even if we start introducing that kind of nutrition training, I don't know how much difference it would make. I think
that's
really
a good point. It's because let's teach nutrition in medical schools. The question is what nutrition? Because standard nutrition, the American Heart Association, many mainstream organizations are still fixated on low-fat diets and lots of whole grains, which for some people is a disaster. They really haven't embraced a low-carb paradigm that includes some animal protein and horror, some saturated fats. I think a couple of ways to go. One is like maybe we should just despair of having proper medical education within medical schools. Maybe we need to encourage doctors to go outside the mainstream to seek out education. There are plenty of educational opportunities. I'm sure you've availed yourself of going to conferences where they're a little bit off the ranch in terms of some of these orthodox recommendations. I mean, you're hearing it from the top too, because I think RFK Jr. is sympathetic to this notion that the dietary guidelines are terrible, that, telling people to have lots and lots of seed oils and low fat dairy and, have a 2 or 3 ounce portion of meat, a couple of times a week, that doesn't cut it for a lot of people.
Right. So there definitely needs to be a lot of shift. Adding additional supportive education that's not within the medical education, like making doctors seek out other places, I think is going to be a challenge because it's I think unless it's, I guess now that I'm speaking, maybe it could be like required CME. That would be a great way, right? Because there are states that require, opioid training. That's now come in like in the last few years. Granted, the quality of that training is extremely variable. And some of it is just, quick videos that you mark off some questions and they're really not so educational. But that could be another way, like mandatory nutrition CME. I think that could be another option.
Well, I think that the success of practices like yours and mine really attests to the desire of the public to get a different opinion, and that it's economically viable for doctors to practice differently. It may require dissociating yourself from a reimbursement model where you're dependent on Medicare, Medicaid, which often doesn't reimburse adequately for nutrition, time spent with patients, talking about lifestyle. But the good news is, I have a perspective is that while there were a handful of integrative physicians in New York when I started 40 plus years ago, they're now more than I can even count. There are literally hundreds. And also what's interesting is there are specialists, because often the holistic doctors would be somebody who started in psychiatry and then I said, well, I can't, psychiatry's not for me. I want to be an integrative doctor. Well, they don't have the specialty background like a cardiologist or a gastroenterologist, where they can really offer a depth of experience and training to patients within a given area.
Right. No, I have seen that more specialists there in my particular field. There has been a tremendous amount. And I think because it kind of functions like a procedure-based surgical type field. So I think the people that go into that field are the ones that kind of love that model, love that lifestyle. Like, truthfully, I learned endoscopy and I did thousands of colonoscopy and endoscopy, but it was never my passion to scope as many people as possible. But most of my peers were really excited about it. That's what they really wanted. So I think that's part, but there's definitely more. There's maybe, I don't know, 6 or 7 of us in the country who are doing that. So I think I think it's a result of two things. One is maybe some people, I hope it's proactive, waking up and realizing like we are failing our chronic disease patients. And I think part of it is that the model, the financial model, is also becoming more challenging, even for procedure based fields that they're looking elsewhere. But I think that is shifting.
Yeah, and that's to the good. So I mean, I feel, they say that imitation is the greatest form of flattery. Is that many physicians and perhaps and people have said, you've been a role model for me. The fact that you were able to successfully pursue a career has encouraged me to enter this field. And I think that that's a great legacy. Is that we've demonstrated that it's doable, that it's helped patients. We haven't run afoul of the law, which is a consideration, because when you deviate from the straight and narrow path, there are people who would brand you a quack, or state medical boards that would penalize you for doing it differently. It's become accepted and more viable, and now with the MAHA movement, I think we're really on the map, and I'm very encouraged by what's happening at the governmental level in terms of encouraging this type of medicine.
Have you found that I don't know if you're still in touch with any of your kind of like former colleagues who maybe weren't aligned? Like, have you found that they're kind of shifting their mindset? Have you found that like it's kind of easier? It's becoming more like it's become easier for you to discuss this with them, that they're more open-minded about it this time?
Uh, yes, and part of it comes from their disenchantment with the conventional medical model, because many of them started out with great leeway as private practice physicians. And then because of medical economics, they became sort of employees of large HMOs and your medical centers and hospitals, and their autonomy has been curtailed. And I think many of them personally have embraced some of the things that we talk about. It may be too late for them to prescribe it for their patients, but they have learned that diet and exercise and optimal sleep and many natural practices are great for themselves and their families.
I have like I recently called I recently called a gastroenterologist for a patient, because I'm not doing colonoscopies, endoscopies anymore, and some of my patients still need it. So I have a network of people I refer to. But then there was one patient whose cousin, I think, was a GI, and he said, "Oh, well, maybe you can contact him," and I contacted him on his behalf. And he was really excited. Like he was like, "I wish I could start doing this too." It was something I never heard before. Usually when I talk to this with my old med school roommates or some of the other people, they thought I was crazy. But now I'm calling random people and they're excited. And in the nail salon the other day, I ran into a dermatologist and she was like, "Wow, I really want to get into functional medicine." And I'm hearing this much more from standard doctors.
That is actually a mid-career choice for many doctors, because they've kind of run up against the wall that they're basically putting Band-Aids on patients. And it's frustrating. The same patients keep coming back. Their problems are not alleviated. They're over-medicated. And so many physicians are saying, look, I have some more career mojo. I have more to contribute. I'd like to work on a more root cause basis and address the underlying reasons that my patients keep relying on medication, coming back sick. And so they take advantage of postgraduate courses, which are available in natural medicine, integrated the IFM, Institute for Functional Medicine. There's other groups sponsored courses. You can virtually go to a course every weekend these days, because there's so many, and learn about this, and develop a repertoire of natural therapies that'll really cut the mustard for your patients.
Absolutely. Absolutely. And I think the first step is just to say, like, to be honest with patients and say, nutrition could really help. I just don't know it yet. But, and I think that is a leap for doctors who we're supposed to know it all. That's how we're trained, right? We're not supposed to not know things. I don't remember when we used to have rounds and we would get questions on rounds. And if you didn't know something, it was so shameful. I don't know if that was your experience.
It's like a paper chase. It really was like a hazing.
Yeah.
If I remember correctly. But, there's actually a famous Jewish physician who lived, I don't know, the 8th or 9th century in Spain, Maimonides, who many hospitals are named after Maimonides because he was a physician. He taught his students, teach thy lips to say, I do not know. And that, I think, is very important, is to, be frank about it. Is, in medicine, we have this hubris that we can fix everything. And there are many things that we need to take another look at and, get away from groupthink and maybe take a more innovative approach.
He ironically was also very into nutrition.
Yes, very into nutrition and lifestyle, very concerned with digestion and bowel movements. Yeah, how important is that? The microbiome. Wow, who'd have thunk? This is like, 1,300 years ago.
I know. And then we became so fancy to go back to the roots, which are really the truth in many ways. So what are you up to these days, Dr. Hoffman? You're writing books?
Yeah, well, books, not so much. I do a lot of writing, and a lot of it is encapsulated in a free newsletter that I provide via drhoffman.com. That's my website. And I'm doing a lot of podcasts. I've got a Q&A podcast this afternoon that I do with our medical nutritionist, Layla Newton. And it's an opportunity for people to write in questions. Write your question to us. We'll answer it on the air. On a podcast, you'll hear the answer and also the answers to a lot of interesting questions. And then I do a weekly radio program that's on Radio America, which you can hear live or you can listen to the podcast. We converted it to a podcast weekend on Mondays. And I interview a lot of guests. And by the way, it's time we revisited with you on my podcast. So let me reciprocate and invite you maybe sometime later this summer or fall. We'll get you back on. We'll talk integrative gastroenterology. How about that?
How about it? Yeah. So thank you. And we'll make sure to post all those places that all these wonderful people who want to know more about how they can get healthy through nutrition and other natural, non-toxic ways that you educate people about. And thank you very much. It was such a pleasure chatting with you today. It's been too long. And good luck educating the people, changing the medical school curriculum, and hopefully changing the healthcare system.
Indeed. And thank you. And congratulations on your podcast and your great efforts at educating the public.
Thank you. Have a great day. We'll see you soon.